Welcome back to this channel. My name is Amna Maiman and I'm a veterinary student. So in this video we'll try and understand about the anesthesia. So maybe this video will be too long, so I will be divided it into many parts. So without further ado, let's dive into it. Right? If we talk about the veterinary profession, so it was with the founding of the veterinary school in Lyon, which is in France, by Claude Bourgelat in 1761, that the veterinary profession can be said to have started, right? So the interaction of the animals with the human is from very, very long ago. We cannot just imagine, right? But if we say that in a very true means that the universities and the colleges and the schools, when they offered the veterinary studies, so it was from the 1761, right? This is for your information. Moving forward, talking about the anesthesia. Number one thing we have to understand that for the anesthesia, the person knows about the physiology and the pharmacology and the internal medicines as well. They are very important. If we talk about the anesthesia, so first of all to keep in mind is that veterinary anesthesia is very very difficult, right? In the sense हमारे पास different तरह के animals, species, breeds आती हैं, right? तो इस वजह से जो है anesthesia provide करना एक जो है वो बहुत लेंदी और एक हार्ड टास्क होता है. इट्स नॉट अ वेरी इजी टास्क. और ये वो टास्क भी नहीं है कि जो हम जनरल मेडिसिन डे टू डे यूज़ कर रहे होते हैं. देयर आर सर्टेन प्रोटोकॉल्स, देयर आर सर्टेन एसओपीज, standard of procedures that are followed when giving the anesthesia to the animal, right? तो ये चीज़ें जो है ये एक एनेस्थेसियोलॉजिस्ट जो है उसको पता होना चाहिए कि एनिमल की फिजियोलॉजी, नॉर्मल फिजियोलॉजी क्या है, फार्माकोलॉजी, अबाउट द फार्माकोलॉजी मीन्स द मैकेनिज्म ऑफ एक्शंस ऑफ द ड्रग्स और द नॉर्मल फार्माकोलॉजी एज वेल or the internal medicines as well, right? So, if we talk about the types of anesthesia, so there with the time the anesthesia have been different types, right? There is a general anesthesia, there is a regional anesthesia, and there is a local anesthesia as well. So, general anesthesia, it means that any drug is going to provide the anesthesia to the whole body. That is a general anesthesia, right? You will be a patient or the animal will be in the rest condition, and the whole body of an animal will be like will be having no any sensation at all, right? And the regional anesthesia, it means that you are just sensitizing, you are just providing the no sensation to the particular area, like to particular region, stomach region, epidural region, right? That is a particular area and you are providing anesthesia, and you are just removing the pain sensation from that particular area. That is a regional anesthesia, right? And the local anesthesia is one when you go to the dentist and they provide the anesthesia to extract the just one teeth from your mouth or the animal's mouth, right? So that is the local anesthesia, providing the anesthesia to the particular, most particular segment of your body. Otherwise, when the patient has a local anesthesia, their whole body almost except that particular point, their whole body feel this pain as well, uh, but that particular point will not feel the pain at all, right? So moving forward, general anesthesia, you can see the cat is having the general anesthesia. Its whole body is quite normal, its whole body is just having no pain sensation at all. Moving forward, this is a local anesthesia, having no any pain or sensation to a local or particular area. And the regional anesthesia, if you have to provide the incision on abdomen, will provide the regional anesthesia particular to the region, right? When the animals have cesarean section, C-section, we most commonly provide the regional anesthesia to those animals as So, moving forward and talking about the word anesthesia, who coined this and what is the definition of anesthesia, basically, right? So, the clinical discipline concerned with the reversible production of insensibility to pain is known as anesthesia. This is quite tough definition, but it is very easy to understand. Basically, the anesthesia is a reversible process, right? You, if you are providing the drug, you can reverse it as well after some amount of time, depending upon the drug concentration and the drug as well. The animal is going to have the normal life and they are going to feel the pain sensation, again in their state, right? So it is a clinical discipline. The people say that, and the books also says like that, many books says like that, the anesthesia is both. It is the science and the art as well, right? Why it is a science? Because it need to be understand about the physiology, pharmacology, and the internal medicine as well. And it is art because of the anesthesiologist, a person who is going to give the anesthesia. It is a very big deal. If you are not handling the animals humanely and you are not following the complete SOPs, then you are also destroying the welfare of the animal, and as well as you are not doing your maybe anesthesia will not work at all, right? So therefore it is art as well as a science. So talking about the person who coined the term, he was the Oliver Wendell Holmes. In 1846 he coined the anesthesia term, right? Very simply, we say anesthesia means no sensation and no consciousness at all. It is a drug induced reversible unconsciousness and no pain sensation.